Now, today in this class, I will discuss another structural disorder of esophagus known as Mallory-Weiss syndrome. Now, in this Mallory-Weiss syndrome, there is tear in mucosa of esophagus. And this tear in mucosa of esophagus is because of again sudden increase in pressure in the esophagus. Intraesophageal pressure suddenly rises. This intraesophageal pressure suddenly rises usually in alcoholics after binge drinking, after drinking when there is severe bout of vomitings. There is tear in mucosa of esophagus at GE junction or just above the GE junction. As a result of this tear in mucosa, there is profuse bleeding. This tear is only in mucosa, it is not through and through tear. And because of this, the blood vessels they get open up because of this tear and there is massive bleeding, severe bleeding. In cases of Borhe's tear, in which there is through and through tear of esophagus, in those cases, the muscular wall of esophagus will contract and blood vessels will close. So, in those cases, bleeding is not so severe. In cases of Borhe's syndrome, the features are because of compromisation in pulmonary functions, because of mediastinitis, because of compromise in cardiac functions. But in these cases of Mallory-Weiss tear, there is profuse bleeding, and so these patients may present with shock, may present in shock. So these patients, whenever they present in OPD or in the ICU, they should be dealt with immediately and the treatment is always symptomatic. So whenever a patient after bout of vomitings present with hematemesis, severe hematemesis, or if patient is in shock, then immediately give symptomatic treatment. In order to diagnose this Mallory-Weiss syndrome, upper GI endoscopy is diagnostic. The tear can be easily visualized with the help of endoscope. If bleeding is very severe, in those cases, electrocoagulation of that tear is done with the help of endoscope. That's the treatment of this Mallory-Weiss tear. Thank you.